Louisville. Thanks for watching KMTV3.
Welcome back. It's a condition that affects 1 in 20 people worldwide. Now, Dr. Bruce is here to talk about fibromyalgia and the hyper syndrome as well, hypermobility syndrome.
Right.
Right. Now, again, could you talk to us about like the cause and like how this affects
Well, the
people?
first thing is fibromyalgia is probably about 4 million people. It's a very common problem, more common in women. It's pain, irritated skin, difficulty with fatigue, problems with their GI tract, diarrhea and constipation. But there are probably several causes. What's happened in the last couple of years is we realized there's a genetic cause of one form of fibromyalgia. Not all, but one. And it probably accounts for as much as 80%. And it's called Ehlers-Danlos hypermobility syndrome. Now we're going to put up a graphic so you understand what it is. And you can find a website called EDNF, Ehlers-Danlos National Foundation, and they will give you about 50 pages of material on it, how to look at it, how to decide and everything. So what does it do? It causes hypermobility. You can take your thumbs when you have this and put them on your wrist. You can take your hands and almost touch your wrist. You can put your knees backwards. You can dislocate your shoulders just for fun, not big fun. And you also can put your legs behind your head, and you can do things that other people can't do because your joints are made of rubber bands instead of leather. So they don't pull and they just come apart and they hurt and they slide and they cause eventually rheumatoid arthritis. So in this case, it's a combination of what we call Ehlers-Danlos looking like fibromyalgia. Now, what's the difference? In fibromyalgia, the treatment is actually exercise. Getting busy, not letting your joints relax, not sitting in bed, not getting in a wheelchair, but being active, because you can actually improve greatly by making your muscles stronger above your joints. And this works. Whereas in chronic fibromyalgia, which may be a different disease, that doesn't work as well. So it's really important to see your primary care physician. Mention Ehlers-Danlos. Again, the graphic gave you an idea what to look at. Ehlers-Danlos hypermobility syndrome. You can find it easily on the internet. And you just need to ask yourself a question. Do I fit those criteria? And it's really important because, again, there are some other medical issues. Your skin doesn't heal well, so suturing or fixing a wound is difficult. You have to do it differently. There are nosebleeds, gum bleeds, difficulties with GI, and finally one called POTS. POTS is when you get up, your blood pressure drops to almost zero, and you're so dizzy you can hardly stand it, and that can be treated.
Yeah, and so how quickly should you go and talk to your doctor about something like that? Like, I know a lot of people look at stuff online, and they might think, I may have this, but when should you actually go see a doctor?
Well, if you've been either diagnosed or you're considering fibromyalgia, that's the time. Okay. Because this is a different disease. We know it's genetic. Now, there isn't a test for it, unfortunately. There's a test for other kinds of Ehlers-Danlos, but not this one. So it's kind of a rule out. When you don't have the others, this is what you have. Okay. But clinically, it's a fairly easy diagnosis. Many physicians now are aware. You might want your PCP, you might want a neurologist. But the big thing in this case is to get an understanding of why you're having all the problems when it's really genetic, because there's a tendency sometimes to call fibromyalgia kind of hypochondriasis. In this case, it's definitely not.
All right. Well, thank you so much, Dr. Bruce, for coming in and always giving us those tips.
The same, James.
Yeah, it's always great having you on the show. Again, we'll be right back with Ryan. He'll take one more look at our weather forecast.